So I'm just connecting. Hello, everyone. Good morning, good afternoon, good night, wherever you are. I'm Carrie Hopkins-Isles, and I'm so pleased to welcome you all on behalf of ICU DDR. We have a really excellent presentation today, and I know that for a fact because we've had it before and it was really excellent. And we're basically back by popular demand. So two of my wonderful friends and colleagues, Anna and Michal, will be talking to you today about preparing addiction study program based on learning outcomes, which I know so many of our members and colleagues and friends are really interested in. And both of these folks are from Charles University in Prague, First Faculty of Medicine, Department of Addictology, which is an amazing place where I was lucky enough to meet both of them, and they have an amazing addictology program. If you're not familiar with what that is, I don't know if that will be mentioned in our discussion today. Okay, good. I think it's really, everyone will be interested to hear about that. So just a couple quick announcements. We have our conference coming up July 20th and 21st. We're putting together the agenda right now. We got some amazing proposals. We have excellent keynote speakers, one of which will be talking about basically like virtual realities and things that are happening in AI and all these interesting things because we are so involved technologically now with our education and networking and advocacy and all the important things we do. So I'm really excited to hear of that. And so I think we'll have a lot of great presentations and opportunities to get to know each other more during that. And I also want to encourage you, if you're not already a member of ISIP, to join ISIP at issup.net. And of course, I want to encourage you to go to our website. I'm excited to say that we have a lot of content. We're adding more content to the website, and if you'll see the sliders on the front page, they are actually new things where we have, if you have 3 minutes, check out this. If you have 5 minutes or 10 minutes, and it's content like our blogs that have been recorded or pieces of webinars like today's webinar. So if you only have a short period of time, you may find some really interesting things there for that. So with that being said, I will hand it over to Anna. Thank you so much for being here, and I will be in the background if you need anything.
Okay, wonderful. So thank you very much for introducing us. I just got a message from Michal that he should be here with us, that I hope he is. And thank you for all the information about the ICU DDR. Just one technical thing. I'm sharing my desktop, so I don't really see if you're writing something in the chat or I don't know if you have your cameras on. So I just don't see you, so I hope you are there. And it's a big pleasure for me that I can do this webinar for you with Michal Miovsky. And I will just start. I have a presentation, of course, and today's topic is, as Carrie said, preparing an addiction study program based on learning outcomes. And I will be talking a lot about our experience, and we'll see what's going to go on in the next slide.
Anna, just to let you know, I'll be able to help monitor the chat, and okay. Right now we do have 26 participants.
Wonderful. Okay, thanks very much. Great. So if there is any question that should be answered, just get into it, Carrie, and just tell me. I'm okay with that.
Okay.
So, thank you. My first question for you is, we don't have much space for interaction here, but I would just like to know where you're from. But as I said, I have problems to see the chat. So I don't know, Carrie, maybe if you can see the chat, thanks.
Of course.
So I'm from Czech Republic, which is Central Europe. So hi from 4 p.m. in the afternoon. And could you just, write the country or the city where you're from, so I can, just, oh, I see, Santiago de Chile. Wonderful. So greetings there. Oh, you at Hampshire. Hello there. 10 a.m. I saw that. That's a wonderful time. Greetings. Oh, Fernando. Hello. And I see Hanoi in Vietnam. Great. I have no idea what time is there right now, but it's on the other side of the world. So wonderful. Tampa. I saw Tampa. Wonderful. Kazakhstan. Central Asia. Hello. Wonderful. Okay. New York. Wow. I've been there a long time ago. Wonderful city. So hello there. Great. Okay. Philippines. Wow. Wonderful. Hello to there too. Okay. So thank you very much for your answers. It's very lovely to know that you're from all over the world. I believe that you are people who really have something to do with addiction programs, and I hope this webinar will be useful for you. Okay, so let's go on. I have 2 more questions for you. You do not have to answer them into the chat or out loud. Okay, Nairobi, Kenya, hello, wonderful, 6 p.m., thank you. And if I can ask you to take a piece of paper or just think it through in your head, or write it in some notes in your PC. If you could just for yourself answer these 2 questions. The first one is, what are your expectations from this webinar? I heard somebody talking. Is there a question?
I will go through and make sure everyone's on mute.
Oh, yeah, thank you, thank you. There were just some sounds in the back. Thanks.
I think that was it.
Okay, thank you. So just, answer these 2 questions. First, about your expectations, and the second one is, what learning outcomes, in terms of knowledge, skills, do you expect you will gain today? So we'll be here together less than an hour now, and maybe you have some thought in your head what you expect you will gain. And if you could just formulate it in the way I will be able to, I don't know, do, name, I will be able to describe, and so on. So just, it's a small, very, very small exercise just for yourself. You can write an answer down. And we will be back to your answers at the end of the presentation. Again, just for yourself, but just to make it interesting, think this through. Of course, I have prepared some learning outcomes for today's webinar. And just to make an introduction to learning outcomes, we're talking about the minimum of what I, in my position now, expect you to gain after this, let's say, lesson or session or webinar. So I believe you will be able to describe the definition of learning outcomes, and you will be able to say at least 2 characteristics. I also believe that you will be able to name at least 1 advantage when you use the learning outcomes in preparing an addiction study program. And the third learning outcome I formulated is, I believe that you will be able to, in terms of your skill, be able to conduct a learning outcome itself. So this is something that I think we can agree on what you're going to be able to do at the end. Just very briefly, thank you. Just very briefly, what is today's agenda, or what is the content of the presentation? Okay, I also saw some answers in the chat, so thank you for that. But today's agenda, the first bullet, we went through that, and in the next steps, I will pass the word to Professor Miovsky, who will introduce the addiction study program in Czech Republic, as Carrie was talking about it. Then I would talk about the European background of learning outcomes and how we understand it here in Central Europe or in Czech Republic in terms of our department. The other part will be about the learning outcomes themselves. We'll talk about the definition, the characteristics, related terms. And in the second part of the presentation, I would like to talk about our experience. I called it a case study of the Czech Republic because we have 3 very good experiences with learning outcomes and how they helped us prepare or make a change in our study program. Then I would sum up what we were talking about. We would get back to the questions I just gave you, and I hope there will be some time for a small discussion. So before I pass the word to Professor Miovsky, I would just like to tell you what you can see now on the pictures. The first picture is a building of Charles University in Prague. The second picture on the left is the first faculty of medicine, which is our faculty, and the third building is our department of addictology, just for you to know where we come from and where you can find us. So now I just try to connect with Professor Miovsky if he hears me, and if he would take the word and say something shortly, briefly about the addiction study program that we have here in Czech Republic.
Thank you, Anna. Hopefully you can hear me.
Yes.
Sorry, I had at the beginning problem with sound, and it was technical problem, maybe problem in my hands and head with connecting the system. Okay, very briefly. We have started designing our program 20 years ago, and at the beginning was the idea have a university study program for people working in outreach work and similar services in addiction field. And at the beginning we had no idea about comprehensive program as we have right now. So within a couple of years, we have designed a bachelor program because in Czech Republic we have a special legislation and for health professions, and we decided to have addiction professionals as a health professionals. It means that we have to adapt our approach and adjust our approach in terms of respecting Czech national legislation and the special law, what is a special act, what is regulating all health professions in the Czech Republic. And basic education, basic level in Czech Republic, fundamental level for all health professions are bachelor programs. It means that it was first step what we have established at the beginning. The second step was establishing master program for students on the higher level, and right now we have 2 different levels of training and education of health and addiction professionals in this area in the Czech Republic. At the same time, we had an idea since beginning to establish also PhD research-based program, and right now we are operating all 3 levels. It means that we have one comprehensive model from bachelor to master to PhD program, and we are providing this education and training specialized and focused on addictions in the Czech Republic in this model. If you would like to know more, because we have no time for many details and other aspects, if you would like to know more about this model and about historical aspects and about curricula, how we designed the curricula and mixed it with UPC and UTC and other issues, you can find it on my ResearchGate profile and Anna ResearchGate profile, where we are sharing all outputs and published papers from the studies and evaluations, what we did and what we conducted in this area on our program. It means that for other details, please check out this paper. Okay, Anna, microphone back to you.
Thank you very much for introducing it very briefly, and yes, we have very little time to speak about it. And I just wanted to say that after the presentation, the last slide, I wrote some references, and you can find the names of the articles that Professor just mentioned. So, and ResearchGate is of course the main resource. So thank you very much, and I'll just go on. I said I'd talk about a bit about the European background in higher education. This is very important when I define what are learning outcomes, because there are many definitions. I will talk about it further, but the European background is something that determines us as the Czech Republic, and this is, I just wanted to introduce it how we understand it here in Europe. I believe you have heard about the Bologna process, so that started in '99. And what is important about it? There was this declaration signed, and today there's over 50 or almost 50 member states that signed this declaration. And the European Higher Education Area is a body that was established. And what is important that the member states continuously adapt their higher education systems, making them more compatible and strengthening their quality assurance mechanisms. So if I say it simply, we really want to understand each other's higher education, and we are trying to unify it in terms of the system, of course, not the content. And this European Higher Education Area, of course, has its tools how to get the goal, and they have very nice websites where you can look it up and read about it more. But just very briefly, they have these 4 tools. Just for example, the credit transfer means that here in Czech Republic, if you go to university, you go through some subjects, you can get some credits. If you go to a university somewhere elsewhere in Europe, you also get some credits, and it's very important for the system to be compatible and transferable. So that's the credit transfer. Then when we talk about diploma supplement, that means that if you get a master's degree in Czech Republic, you should be readable and understandable for somebody from, I don't know, I see Spain or some other European country. And what is important, that they have the tool of qualification frameworks. That's nothing else than a framework where they try to formulate in a very general way learning outcomes of different study fields. And their aim is, or they recommend to the member states, to adapt the qualification frameworks, of course, due to the needs of the countries that adapt the system, and to formulate their own learning outcomes. So again, it's more understandable of what you learn when you study addictology in Czech Republic and what you learn when you study addictology elsewhere in Europe. So just to understand the European background, European Higher Education Area is a very important body for us. Now to the learning outcomes themselves. When we talk about the definition, again, it's very important to say there's no precise agreement about the term. If you look into literature, you can find many different points of view, and that's why I was talking about the European background, which is important for us. I'll just move this so you can see. Okay.
I was just going to. Thank you.
Yeah. So here are just some 4 very important characteristics about the learning outcomes. They are statements of what a learner is expected to know or understand or be able to do after a period of learning. So this is something that we agree on, what are learning outcomes. Important is that they are very explicit statements. Again, we're talking about results of learning. Okay, so the student gets some amount of the learning, and we expect him to have some kind of result. Also, we're talking about the mixture of knowledge, skills, abilities, attitudes. You can also find some more attributes in different papers. But if I go back to the European background and how we think about learning outcomes, we always talk about knowledge, skills, and we have this 3rd component, which is called general competencies. It's not really competencies, it's a bit confusing, the term. But we have these, or the learning outcomes have these 3 components. Knowledge, I believe, is very understandable. It's what you know. Skills are what you're able to do or demonstrate. And the general competencies, they talk about what the student is able to do, but it doesn't matter what field of study he is studying. Okay, so it's just, for example, to understand it, a general competency is that the student is able to present his presentation, okay? Because, you know, it doesn't matter if you study addictology or if you study psychology, you can always be able to gain this learning outcome. So that's the next one. And I also put the fourth characteristic of learning outcomes is that we can look at it as a methodological approach for expressing and describing a curriculum, which is very important in context of our experience here in Czech Republic. So these are like four very basic definitions, so we could understand what we were talking about when we were talking about learning outcomes. Okay, I'm trying to move, but the presentation isn't moving. Oh, good. Yes. Related terms. This is very important because if you are, doing and working in the field of education, I believe you are very familiar with these terms. But just to be clear, when we describe, let's say, a subject, to be concrete on some example, we can talk about aims. Aims are very broad general statements of the teaching intention, okay? That's when we say what we intend to teach the student, if I say it in a different way. When we talk about goals, we actually talk about aims. It's the same word. It doesn't have a different meaning. And just for an example, I wrote a goal so you can imagine it better. A goal can be, for example, to provide a general, or the goal of the subject is to provide a general introduction to the history of the harm reduction approach. Now, important is that we are saying that we're just, providing an introduction. It doesn't say anything about what we expect the student to be able to do after the subject. So that's an aim or a goal. Now, there's another term, objectives, or learning objectives. I think you are also familiar with this word. Again, there is a little difference between aims, goals, and objectives, because an objective is a specific statement, okay? It's not that broad in general, it's very specific. But again, we're talking about a teaching intention. Now, just to see the difference, I wrote another example. An objective is that students would understand the impacts and effects of addiction or risk behaviors. So if we look at it, it looks very specific because we're talking about impacts and effects of addiction risk behaviors. But in comparison to learning outcomes, the objective says that the student would understand. And we really have no idea, if I would be a student, what the teacher wants me to do when I should understand something. Okay, so that's the point, and that's the difference of these terms. And to be complete, I also wrote the definition of the competencies. Now, this can be very confusing sometimes because as we do not have an agreement on what learning outcomes are, we also do not have an agreement on what are competencies. And we always have to talk about the definition we are using when we are talking about the term. I, again, just wrote a very brief definition in contrary to the learning outcomes. A competence is used to represent a combination of attributes, and I spoke about that the slide before. We talk about knowledge and its application, skills, responsibilities, attitudes. So it's much broader, and it very much depends on what definition we choose. Also, one more point to the competencies. When we talk about competencies, they are actually outcome-based. That's a characteristic that you can find often in literature, that it's outcome-based. So that means that the competencies are a superior term to learning outcomes. Okay, so I don't want to make it more confusing than it is right now, but it's very important to understand the terms. So again, okay, my presentation doesn't move again. Okay, it moves now. Two more terms. When we talk about preparing an addiction study program or whatever program, we think about the approach that we use. And these two terms are very popular in the field of education, like for the last 50 years. But still, we find many programs that are teacher-centered When we talk about the teacher-centered approach, we talk about a very traditional approach. It is something I think all of us know very much on our own skin. It's when you come into a classroom, into a lesson, into your subject, and you just, if you're in the role of the student, you just sit there and you just listen to your teacher, and nobody just really tells you what you're expected to do. Again, I'm going to make it in a very simple way. Of course, it's more complicated, but again, student-centered, that's in contrary, is something that is connected to learning outcomes. If you use learning outcomes in your study program, you are definitely very close to using the student-centered approach. That means that you care about what the student or how the student understands what he is learning. And that is something that we really want. We really want the student to understand what he's learning, to want to discuss it and think about it. And if, for example, we have this subject, in the beginning of the subject, we should tell the student what we expect him to do at the end of the subject or of the lesson. Now, this is very crucial, and what helps us is to use the learning outcomes, because the student should really understand. If we want him to be able to argue about something, if we want him to be able to, just name something or describe something, or if we really want him to be able to talk, for example, with a patient, okay? So he should really know what we are expecting him to do after it. So that is student-centered approach. Again, there are books written about this topic, but very briefly, this is very important. When we talk about learning outcomes, again, as I said, European background, we talk about 3 levels. We can formulate learning outcomes for different levels of application. Let's say the lowest, well, not really lowest, but the most focused level is local. That means that we formulate learning outcomes for, or the university defines or formulates its own learning outcomes. For example, for a course or a unit or a module or subject, or for a program, of course. So we can start formulating learning outcomes for different subjects in our study program. And of course, we can make it more general and formulate learning outcomes for our whole study program, but it's still the local level. Then, if you go to the national level, it means, as I spoke about it before, we talk about the qualification frameworks, where it's called this way. So we can formulate what an addictologist or addiction worker or addiction specialist, depends how we call it, will be able to do and to know after graduating from the addiction study program, but it doesn't depend on which university he studied. So that's the national level. Then we have the international level, and that means that it doesn't really matter in what country he studied the program. So just to understand that we can think about learning outcomes on different levels of application. If I sum it up, learning outcomes are very explicit statements. We really have to think about the way we formulate them. We have to think about the way, or about the words we use. We really have to use active verbs, so it's very understandable. Learning outcomes are measurable. This means that I can measure if the student has or is able to do what I expect him to do. Okay, so that means that in the beginning, if I tell him the student has to be able to name some characteristics, I have to be able to measure it if he really knows it. So they're measurable. Learning outcomes are connected to the student-centered approach, education. And when we talk about learning outcomes, we always talk about knowledge and skills. Now we're going into the next part of the presentation. as I said in the beginning, we would like to present our experience in Czech Republic. I divided it into three, called them case studies. There are three different situations where we have, at our Department of Addictology, used the topic or used the approach of learning outcomes. The first one was when I was analyzing our study program throughout the learning outcomes, when we tried to actually identify them. The second experience was when we implemented the UPC. As it was said, we have a very nice article on this topic, but I will briefly describe the process. And our third experience was when we constructed or conducted an international study program. So I will talk about them further. So the first one was when we analyzed the study program. The problem was that we had a very nice study program. We still have a very nice addiction study program. But when we looked, inside it, we found out that we didn't really precisely formulate the learning outcomes and the competencies. So we did this content analysis and tried to identify the learning outcomes. In some ways we had to reformulate them. In some terms we had to formulate them like a whole. And it was also connected to the identification of the competencies, which I said is a superior term for learning outcomes. And so this was like the first, or for me, this was the first time I met the learning outcomes. And I will just show you an example of how it looks when we formulated them. Okay. So here's an example. One of the areas of competences of our graduate in Czech Republic is that he has some knowledge and skills in the area of medicine and nursing. So if you read the competence, you can just very generally read that he has some knowledge and skills in the field of psychiatry, pediatrics, neuroscience, clinical toxicology. He is able to diagnostic classification manuals, use these manuals. Okay, sorry, something happened during anti-control control. Okay, good, fixed it. So you can read about the topics, about the themes that the student is able to do something, but you don't really know what. And then we, here in the second part, the knowledge, we tried to state what knowledge does the student have. So the student in the area of medicine and nursing is able to explain and characterize the importance of diagnostic manuals and categories of diagnosis. He is able to identify and characterize major groups of psychological disorders, which if you think about is like a very good competence. And with regard to the diagnostic manuals, of course. So now you know what the student knows, and what is more important, you also know what the student is able to do in terms of skills. So the graduate of our program is able to recognize and describe a possible psychiatric illness in a patient and to argue for appropriate intervention, which is like a very, very big skill that we want our students to be able to do. And these two, the knowledge and the skill, are the learning outcomes, and we describe the learning outcomes for many areas of the study of our graduates. So that was the example one. And if okay. Now I would be talking about experience, which was when we I called it reconstructing. I know it's not really English, I couldn't think of a better word, but we made a reaccreditation of our study program, which we have to do in some periods. And when we were doing it the last time, I think it was 2 years ago, we implemented the UTC and the UPC. And I've got just UPC written here because we found out that the prevention part of our program was still much stronger than in other programs in the world, but we wanted to strengthen it more. And I will show you what we actually did in the bachelor's level. We had to put more subjects and more topics to broaden actually the profile of the graduate. And we analyzed what learning outcomes we found in the previous accreditation file. You can see the sentence where I say that the prevention learning outcomes were spread into many other courses. And we really wanted to get them out and identify them. And what happened at the bachelor's level actually was that we added new subjects and we put more hours of the prevention into the study program. You can see the four new subjects that we added. We also changed the master's level when we implemented UPC, and there was actually the same problem that in the learning outcomes they spread all over the other subjects in the program. And in the master's level, we didn't really have prevention-specific subjects, and we wanted to have the graduates that are able and have some competencies in the area of prevention. So again, due to the UPC, we added new subjects and we identified new learning outcomes. So this was the second time that we had a good experience with working with learning outcomes. And the third one was when we created an international study program combining UPC, UTC, the Prague model, which is the model of our addiction study program, and the competency model. And I would say that we actually really had to change the point of view we were thinking about an addiction study program. One short note, we didn't open it yet, the study program, but we hope we will in a close time. We'll see. That's not my job actually. But I have also some pictures then I would like to show you, and why I have this example here. It's a very challenging work when you want to create something new, and it's much more challenging when you have already created something that is very good, and you have to find a new way of thinking. And we were always thinking about subjects and topics, and this is something that you can also find all over the world. When you read about different study programs, you can see lots of subjects and terms and topics. But we went from some other side, and we said, okay, but we first have to know what we expect an international student to know about addictology or about addictions, which is very different from what we expect a Czech student to know. Of course, there's something that's same, of course. UPC and UTC really helps us with that. But we can't really want from or expect from an international student to very specifically know something about the specific situation in Czech Republic. In some terms, yes, but not in the same terms as a Czech student. And we had all of these problems that we have to think through, or we had to think through when we were trying to conduct this study program. And I will just show you how it looked, so you can just see that we're really just people, and we made lots of brainstorming and thinking and meetings. And if you look at the first picture with the yellow cards, this is when we started to think about the learning outcomes and wrote them down, and discussed a lot of hours, what we expect the graduate to be able to do. We created lots of maps and graphs, and then we had to think through all the subjects that the program will have and the time plan and so on and so on. But what was important is that we always went back to the learning outcomes and asked, okay, what subjects will give this learning outcome to the student? And is there some other subjects that we will find the learning outcomes? And we are missing some subject to meet these learning outcomes of the student. So this was a very creative process, and I think we have prepared a very nice new program. So just maybe to encourage you, or maybe you have your own experiences with it, but to encourage you that it is possible, and the point of view of competencies and learning outcomes definitely makes sense and helps with the process. Now, at this point, I'd maybe ask my boss if he wants to say something more to these experiences with the learning outcomes, or.
Yeah, thank you, Anna. I think that it's very clear, but on the other hand, I think that there is good to know that there are many aspects where we have no enough time to discuss it. For instance, we are talking about knowledge, skills, and competencies, and on the other hand, we are talking about different subjects, different courses, how to achieve this level, and we are trying to mix theoretical based courses with clinical trainings, and that's totally different story, because how to mix courses where is the core based on a theoretical knowledge and discussions and interactive working with clinical training in the field, where students take practice and try to train their skills in practical services in the field, for instance, in real harm reduction services, in therapeutic communities, in aftercare services. That's totally different. And at the same time, I think that especially for this issue, we have no enough time. Maybe some of you remember a perfect workshop what was given by Beatrice Katungu in Kenya on ISAP conference, where her students and herself provided wonderful workshop how to combine and how to develop and how to assess clinical training for students. And I try to emphasize that we have no enough time for discussing all of these aspects, and Anna was focusing on the core, where we have tried to build the core structure of the study program. That's one comment and one limit of today's session, of today's webinar. The second comment is that we have in many countries and regions, we have a totally different traditions how to build original university study programs, and we have totally different understanding what is normal and useful to achieve at the bachelor, master, or PhD level. And you have to be very careful with these traditions, because, for instance, Anna was mentioning at the beginning Bologna process, what is really strong formative process around all European countries. On the other hand, after 2 decades of this process, we have a very different models in many European countries. And for instance, in United Kingdom, they have totally different higher education and university study programs. It means that you have to be very careful with all issues what we are talking today, and be very careful if we are understand each other in using these terms and these definitions, because there are too many traditions that's maybe for more careful approach and your tolerance. Thank you.
Thank you very much for these comments. I think this was a very important window into the reality because I believe I'm talking about a very ideal picture of the processes and of how it looks, and it carries many problems on the local level and many differences on the international level. So thank you for the comments. It of course has many problems. It's not so ideal as it can sound. And so just here I wanted to sum up the second part of the presentation, what I was talking about, and maybe the message I wanted to give you. And it's very general, but I'd like you to think about the learning outcomes as a tool, something that can be very helpful, something that can help with transparency. That means that your program or whatever you're doing, even on the level of the subject, you can be very understandable. And I'm just gonna move this here. And the more you are precise in formulating what you expect your students to be able to do, I think the further you get, actually. The other point is that we are talking about increasing quality of the study programs, because if we are transparent and we know what we are teaching, we are increasing quality. And the fourth point is that I think we can increase the attractiveness of the study programs, because if, I know again this is kind of ideal, but if you get recognizable for other countries or other study programs, it doesn't really have to be only between countries, maybe if you are thinking about some international programs, you can really increase your attractiveness. And this helps the mobility of students and teachers, and that's actually something that we are all trying to do, because this is what increases actually the quality of higher education.
Sorry, Anna, may I interrupt you?
Sure.
I think that what you really said right now is the core, and I think that's probably the most important thing in my eyes of this today's webinar. We are talking about addiction professionals and university programs, university study programs and training for addiction professionals. So it practically means that we are talking about very difficult, very complicated, long-term formative process of emerging completely new professionals, completely new professional group with specializing, with special focus on addictions. And it means that we are talking about special new concept of profession, what is dedicated specifically to addictions and addiction issues. And it means that we are talking about emerging and starting international process of creating this concept and sharing this concept. What is pretty difficult, by the way, you can take parallel process, that you can take a lesson from another professions. For instance, we are witnessing the same process in psychology, what is running almost 100 years, and still we have no same concept and same structure of psychology study programs in all European and American states. It means that it's so difficult what the appropriate, what kind of courses, what kind of clinical trainings and things like that. And it means that right now we are talking about completely same process, but specifically for addiction field. What is challenging, but on the other hand, I think that it needs and it calls for more respect and tolerance from all of us, that this process will take decades, really many years of discussion and sharing our experiences, because right now we are formatting really new professional group what will be studied, a new generation of addiction professionals will study on universities. But for establishing this new profession and defining of this qualification standard, it's really a long-term process what will take decades. I have to say it again because I think that sometimes it's not clear, and sometimes we are talking about many things like that. But on the other hand, I think that this is probably the core of today's webinar to reflect this fact. Thanks, Anna.
Thank you. Yes, I would subscribe that. That's very important. Okay. We're actually almost in the end. I think this was a perfect ending from Professor, but just, you know, to make it nice at the end. I wanted to get back to this slide from the beginning of the presentation where I stated some learning outcomes, and just wanted to remind that my goal was that I would be happy if you would be able to describe the definition of learning outcomes and at least 2 characteristics, to name some advantages of using learning outcomes and to conduct 1 learning outcome at least. That's a minimum. And I would maybe add what was said now at the end, that what would be perfect for you to gain as a new knowledge or as something to be reminded is that we are all trying to increase the quality and the transparency and get us more understandable and readable for each other. But we still have to think about the respect to different traditions and different approaches that are all over the world. So this is something I would just add to the learning outcomes. And I also said, if my slides go, they don't want to go again, because I said I would get back to the questions I stated in the beginning of the presentation. And maybe just again for yourself, you can answer if the expectation you had at the beginning was actually met. And if you are able to do what you expected to do after this webinar, if we have met your learning outcomes as you have formulated them for yourself. And we can discuss about this, but also I hope we have some time left for some of your questions and comments. And so I'm just finishing and passing the word back to you. And I see Fernando answering that his expectations were met, so I'm very glad with that. Great. And I'm going to stop sharing the desktop, so maybe I can see you, okay?
Thank you.
Thank you very much. Wonderful.
Excellent. Really enjoyed it. Thank you so much. And there were some nice comments during, positive, bravo, and evidence-based and rich presentation. But I would like to open up the conversation to if anyone has questions. You have a couple options. You can unmute yourself. If you're not sure how to do that, you can raise your hand if you see this hand icon, and I can unmute you, or you can also type something in the chat and I can read out your question, or hopefully Anna can see it as well. So we do have a couple minutes left if anyone would like to ask anything. I know there was a question that was for me about the recording, and so just to let everyone know, if you go to icuddr.org, if you go in later this week, then you will probably see it right on the home page. It'll say if you missed this webinar, and you can click on it. But in the future, all of our webinar recordings live in the resource section, so you can always go to our resources and check out any webinars that you may have missed.
If may I have a comment in the meantime, because I see no hands raised up. Maybe some of you have an internal question why we have a GCCC and our independent exams, and that's that's probably a very sensitive issue in this context, but on the other hand, this is really right to mention it right now, because sometimes we have, as the universities, we have a expectation and idea and approach and attitude that we are only one who are testing students and that we have the legal right to test our students with their competencies. But on the other hand, the one issue is the international recognizability, because as you know, different universities in different countries have a different quality level. It means that sometimes it's not so easy to say that all students graduated from same program have a comparable level of knowledge, skills, and competencies. What implicates a very sensitive issue and raised very sensitive issue for the future. We need probably have some international independent exam or system how to test this quality. I know, and you can be sure that I'm perfectly aware of the fact how sensitive it is. But on the other hand, I think that for real sharing this concept and recognizing these outputs from our programs, it's necessary to speak about these sensitive issues. So it means that that's function of GCCC, and at the same time, there are many ways how students and trainees can achieve different levels. It means that sometimes it can to be achieved by training provided by university. And of course, all of us probably believe that university training is providing something guarantee, some assurance that it's fine and that it has a higher quality level. But at the same time, on the other hand, we have students and trainees achieve this level through different trainings provided by NGOs and some training institutes. It means that we have to define different levels, different qualification levels, and have some independent body for testing if students and trainees really achieved these levels. And of course, again, as I said, it's pretty sensitive, and at the same time, probably some of you have another question, but I think that what this body in our family of institutions is providing has exactly this background.
Thank you, Michal. We have a question from Dr. Francis. He's talking about the fact that, as Anna mentioned, you all had a comprehensive program with learning outcomes before you introduced UPC and UTC. So he's asking, when you introduced UTC and UPC, what were the new learning outcomes that you added?
Yeah, maybe it's a question probably on me. We designed, as I mentioned before, we designed our study program and our curriculum almost 20 years ago, and there was no UPC and UTC in that time. And in Europe was only a small group of university study programs, and all of us at that time, we had totally different curricula. It means that we didn't share information about our curricula and we didn't share our experiences. And we met UPC and UTC for the first time in 2015 and 2016. And when I saw it and read the content, I thought that we have a pretty high overlap with both curricula. But on the other hand, I also saw gaps. And the gaps, you know, when I see gaps, it means that it's challenging me always. And I have decided that we have to do something with it, because UTC, it was probably very simple, because UTC is something very familiar with our program and with our teachers, and there was nothing new. But on the other hand, when I saw UPC, and when I met Willy and spoke with Willy Sloboda about it, I saw that our program is really poor in terms in school prevention and family prevention and this area. And improving our program was about really implementation process of UPC, and it was really challenging time for me and for our team, because as I said, the gaps were pretty deep and we were missing some courses and some subjects what was necessary to add into our curricula.
Well, I'm going to end there because it will be perfect timing, and I think we've all gotten a lot of great information today. So thank you to both of you. We're so grateful for your time and this excellent information. And once again, thank you from ICU DDR, and please do visit our website.
Thank you very much. Hello to all parts of the world. So
thank you, Carrie, for providing it and taking care for us. Thank you, and thanks to all of you for participating on today, and to Anna for taking leadership. Thank you.
Yes, great job. Thank you. Take care.
Thank you.
Have a nice day and stay safe to all of you.